The Washington Examiner's Sarah Westwood joining us right now. Sarah, what do you think of that?
It's clear that the administration has a big commitment to this, like you said, bipartisanly popular initiative, because there were 4 cabinet secretaries in that room with President Trump, and they are all sort of indicative of the commitment that's going to come across the federal government to attack this from all sides, right? You had VA Secretary David Shulkin there. Obviously, drug addiction is a big problem with veterans. It's clear they're going to address it from that angle. We had Education Secretary Betsy DeVos there to address the problem that the nation's youth has with drugs. We had Department of Homeland Security Secretary Kelly there. Obviously, drug abuse and drug trafficking underpins a lot of President Trump's push for stronger borders. And obviously, Attorney General Jeff Sessions was sitting right next to President Trump. This is a law enforcement issue as well. So you had sort of a presence of people who were demonstrating the signal the White House wants to send, that they want to attack this problem from all sides and that it's worth consuming the time of such high-profile people in the administration, including the president himself.
You know, I don't remember seeing or witnessing anything quite like this in the Republican or Democratic administrations, at least not in live, real time. We came very close, I know, with Jimmy Carter, Rosalind Carter. We didn't have the capacity and the technology we do today where they were addressing mental health, particularly Rosalind Carter. But this is a sort of akin to that, and the state of our mental health, our physical health, and all the problems with opioids. But it's always about money, right? I mean, and whether programs or initiatives undertaken in individual states like New Jersey are going to be enough.
Exactly. Luckily for the Trump administration, this is not going to be an issue that's likely going to draw a lot of resistance from Democrats. So if they wanted to get this appropriated at the federal level for programs, they are not going to have that much of a difficult time. And this actually might be a smart thing to pursue early on, why they are having trouble, like you said, with the health care situation. They're not getting traction on that front. This is a legislative battle that could be an easy win, that would be popular, and that would do real good for people. So it's smart for the administration to pursue this now, and once they're drawing more attention to the problem of illegal drugs trafficking over the southern border, that's going to help the president's argument as he tries to move forward getting appropriations for the construction of the wall.
I would imagine on this opioid discussion captured on White House cameras here that this is part and parcel of that, and looking at health care, right?
Right. I mean, they want to show that they have a broad portfolio of things they're looking at, that they're willing to engage people from across the spectrum. You saw a very broad variety of people, from families who were affected to law enforcement officials down to the state level. I believe the Florida Attorney General was there as well. So they're willing to bring in people from all sides. These listening sessions have become sort of a unique feature of the Trump administration. And there are some critics who wished the Trump administration had had more of those dealing with health care prior to the AHCA debacle, but that's something that they've likely learned from, and you might expect to see some of these listening sessions about health care moving forward.
All right. Thank you, Sarah Westwood, very much. You don't see this sort of thing often. But for this president to put in perspective that issues come and go, and various pieces of legislation come and go. But man, that was pretty impressive.